Good afternoon. Happy Sunday. Thank you all for being here. As noted yesterday, this is the first Sunday in memory for many North Dakotans when there weren't church service statewide. We're going to start off today's briefing with a prayer from Lieutenant Colonel Jon Wymer, who serves as the state/staff chaplain for the North Dakota National Guard. And of course, you know, we've got, I know we have one of the best National Guard groups in the country. They're doing fantastic work through all the things we're doing right now for emergency services, as well as getting prepared for the possibility of spring flooding. We do have Guards, men and women that are serving on missions. We've had Guards, men and women serving continuously in combat zones since the USS Cole. So this is going on 19 years, pre-9/11, when we've had Guards, men and women serving around the world, helping protect our nation. And of course, Lieutenant Colonel Wymer is one of those fine people in that service, and so we'd like to invite him here to open with a prayer. Thank you.
Let's pray. Everlasting God, we approach you today as the Lord and giver of life, grateful for your presence in our world. We take this moment to pray for those sick with coronavirus, those who are hospitalized, and all of us who are fearful. We ask that you help us turn our fear into action, the action of remaining deliberate and calm, the action of making selfless choices for the good of the community, and the action of creative connection with others while we are physically distanced. We thank you today for all who are battling against coronavirus, those who work in healthcare, in education, in logistics and transportation, in providing basic services we rely upon, and all those who are taking steps to slow the spread of the virus. I ask that you give each one of us strength and wisdom we badly need, and I ask that you help us to know and to remember that our finest hours as North Dakotans and Americans are when we face incredible odds as a community of strength. In Jesus' name, amen.
Thank you, Chaplain. And again, want to thank the thousands of North Dakotans who serve in the Guard. Their motto is always ready, always there, and they're ready right now. They've been working on planning, contingency planning, to be a part of this emergency that we're in. And of course, you've seen the leader, Adjutant General, Major General Alan Dorman, here at the podium. He's working with his team this afternoon on planning exercises, not here today, but they continue to work 7 days a week for all of us here in North Dakota. First topic today is the case update. North Dakota Department of Health confirmed 2 additional cases of the novel coronavirus disease, or COVID-19, one in Burleigh County and another one in Pierce County. In Burleigh, it was a woman in her 30s, travel related, and Pierce was a man in his 40s who had close contact with a known positive. That brings our totals to 1,355 total tested in the state of North Dakota. That's 173 tests completed from yesterday. 171 of those were negative. 2 of those were positive. And it brings us to a total of 30 positive statewide. We have 1 additional individual who's been hospitalized. None of those previously hospitalized have been released, so we're now up to 4 hospitalizations related to COVID-19. I do want to also add that we are tracking what's going on in all of our neighboring states. And Clay County, we did learn just before this conference, had a 1 positive today. And so again, we would think of Clay County and other counties that border our eastern border, where we've got metro areas that extend across the border. We have to be paying attention to that, because we should really treat those Minnesota positives as occurring in metro areas that are largely made up of North Dakotans. We're obviously pleased that from a testing standpoint, that we've only got 2 more individuals who tested positive in North Dakota, but we still have a number of concerns, and those concerns relate to what's going on in our neighboring states and what's going on nationally and internationally, because again, where we see places in the world where the where the virus has advanced gives us a glimpse into what might be coming here. Spain had a huge increase in deaths reported from the COVID yesterday, not unlike Italy. Italy, I think we reported 743 yesterday. Italy had another 600 plus today in terms of deaths. But one of the things that's troubling coming out of Spain is when they got in a situation where they were running out of personal protective equipment, which we're all learning that acronym PPE, that in Spain there are now over 3,500 healthcare workers who have been sidelined because they've had an infection. So this is why the continued efforts that we're doing here to slow the spread, to allow us to be prepared for a surge in medical needs, both equipment, personnel, and beds are the three things we want to make sure we've got time to work on. Make sure that line is as high as it can be in terms of our available capacity. So this is not the time to get complacent at all based on what's going on internationally, but let's talk a little bit about our neighbors. I had an opportunity to speak live with Governor Kristi Noem from South Dakota today, and at a press conference at 11:30 today, she announced 6 new cases in Beadle County. That's in the Huron, South Dakota area, including 4 of those 6 cases were people under the age of 30. And again, if people, just from a geography standpoint, Huron would be south of the Oaks-Ellendale region, south of Aberdeen. It's actually right on the James River, so think of it as south of Jamestown in South Dakota. This is a community of 13,000 people that may have, like other communities in North Dakota, say, hey, we don't have any cases, and then you wake up and you find out you've got 6 cases. But those 6 cases have been in contact with dozens or perhaps more than dozens of people in Huron through their activities, through their normal lives and their normal activities over the past week. And so South Dakota is bracing for the possibility of community spread in that size community. And I just want to make sure that everybody understands that this could happen at any time in any community in North Dakota. There's no community that's immune. There's no geography in the world that's immune from this, and that's why social distancing is so important, whether you're in a rural area or whether you're in our urban areas. We have more cases than South Dakota in terms of positive tests, but we also have done almost twice as much testing on a per capita basis as South Dakota. So we should assume that in states around us that haven't done as much testing does not mean they've got fewer cases. It just means that there's been less discovery of the positives. Montana, I had spoke earlier this afternoon with Montana Governor Steve Bullock. And Montana is, they have 31 positives, but one of their new cases that they reported today is the one that's closest to North Dakota so far of their positives, and that came from Roosevelt County. Roosevelt County, the majority of Roosevelt County, Fort Peck Indian Reservation, which is a significant sized Indian reservation, spans touches multiple counties, but virtually all of Roosevelt County is within the boundaries of that, and just past Sheridan County, which is just past Williston, so this is effectively on our northwest border, but it also signals what we've been talking about and what we've been planning for, is that the possibility for spread in our tribal areas is also a very real possibility. A final reason why we want to not become complacent is that we've learned from having discussions today with the Fargo president of Sanford, Brian Niermo, a personal call with him twice today. They were, as many health organizations were around the country, utilizing available resources from national labs. Quest Lab in particular was one that you might remember a week ago that came online to help process testing. Sanford had been and still continues to work closely with the North Dakota Department of Health. They were sending some of their most urgent cases, the ones that were the most highest suspects, to the state lab, where we were turning around lab tests in 24 to 36 hours, getting a lot of compliments from the private sector on the North Dakota State Lab. So our small team there continues to do a great job. Quest, like other national providers, was overwhelmed, and the turnaround time time initially was expected to be 3 days. They have extended that to 7 days for turnaround time, and so there are 300 test samples that were collected in Cass County that have been sent out nationally that we do not have results back. We as I said, we've as a state collected 1,355 total tests, but you put 300 on that, that's like almost another 20+% test that could come in over the next couple days. And so we might see that from that part of the state, so either eastern North Dakota or northwestern Minnesota, because those could have been Minnesota people getting tested in Cass County. We could see a step up there. So again, we should presume, given that large number of pendings, that we have more cases that are out there than we know of. And in particular, I would say for the Cass Clay area, we likely have more cases there than we're aware of because we have the large pending case count. So again, we are continuing holding our course on trying to make sure that we practice the social distancing that we've talked about across the state. And again, thanks go out to everybody all the heroes that are collaborating with that and taking that seriously. And I think, again, a key element here, it relates to self-isolating. If you're sick, stay home. If you're sick, work from home. Washing your hands, staying 6 feet away from others is the best way for us to prevent the spread or slow down the spread. But given that we don't see anywhere in the country where we're going to be able to do in any time in the next few weeks, be able to get to hey, everybody that wants a test can get a test, because if you could test the entire universe, then you could identify who needs to be isolated and who doesn't. That would be great. In absence of that, the one thing that we can do that doesn't require swabs or ventilators or equipment from any other state. But one thing we can do here in North Dakota, which I've directed my team this afternoon to undertake, is we want to have a huge step up in what we've called contract tracing. At a briefing several days ago, we had one of our experts from the Department of Health describe that process, and our team at Department of Health, small team over there that's been doing this. They've got 97 individuals that they're monitoring. When we have someone who's had known contact with a positive, then we're really monitoring those individuals, but we want to step this up. Every time we get a positive, we want to make sure that we're being super thorough on who all the possibilities that they may have come in contact with. And so if we can amp up the contact tracing, there's one prefecture, think of that as a state, but a governmental subdivision in Japan that's been very successful at aggressive contact tracing. They had one example of a doctor who came down with the COVID-19, and they traced back that individual, they identified 470 individuals that might have been within 6 feet of that doctor and had contacted them, and were tracing all of those people. And so again, we want to take this to the next level, because this is one thing we can do. And if we got to bring, again, folks, whether we're exploring public health, students from NDSU and UND. We're exploring, nurses that may have additional capacity if we're slowing down elective surgeries. There are, other places where we could get healthcare workers that we could bring on to build up our capability, both on the public sector side and the private sector side. But again, you expect to hear more updates from us. But we have a plan starting today to try to dramatically increase what we're doing on contract tracing. So that's the update on the testing and results and what we're doing on contact tracing. Next is some couple items on recap. Earlier this week, I believe it was Friday, we had two superintendents here, Superintendent Baszler, and we talked about our plan going forward for K-12. No changes in that, but over the weekend, working with DPI and working with folks, we formalized all that and put that into an executive executive order, which is now up online. And the highlights of that executive order include the districts have until Friday, March 27th to submit their plans for resuming instruction with age-appropriate alternative or distance learning methods. Districts have until April 1st to get ready to launch those plans. We have the expectation that they're going to start resuming instruction on April 1st. We are again waiving the next 7 days, so the 5 days this week and the 2 days of the following week. So that brings it to a total of 12 days that have been waived, meaning that we've shortened the school year in North Dakota from 175 days to 163. Those will not have to be made up, and there'll be full payment for those 12 days that were waived. But again, starting on April 1, schools that aren't ready to resume instruction on April 1 then must consider extending their academic school year into June. And we have the way state payment goes out to school districts, the final payment is due on April 1st. Schools that have their plans submitted by Friday and approved by March 31st will receive their state aid on time for April 1st. Those that do not have approved plans those payments will be withheld until they have an approved plan. As we said, we can't, this pandemic can disrupt our lives, but we also have a responsibility to our students and to our taxpayers of an education that prepares them to succeed in this economy. And this is a good test for us as adults to figure out a way to deliver education during these challenging and unusual times. So again, I want to thank all of the superintendents that have participated in helping create this direction, all the folks that have already put together their plans that are ready to go, and want to thank all of the leaders, school board members and teachers and everybody that will continue to work from now till Friday to put together great educational plans for the over 113,000 students that we have in K-12 public schools in North Dakota. And again, that executive order and details of that are online, including who's included and who's excluded from that executive order. Next, I want to talk about gratitude for the tribal chairmen and that we have across the state, chairmen and chairwomen. Again, Friday night, we had a 2-hour call with all of our tribal chairs. They're all making some really tough decisions regarding shutting down casinos. As of either by this afternoon or by tomorrow morning, Prairie Nights at Standing Rock, Grand Treasure at Trenton, Forebears in Newtown, Sky Dancer in Belcourt, Spirit Lake at Spirit Lake by Devil's Lake, and Dakota Magic near Wahpeton will all be closed. These are not easy decisions for the sovereign nations to make, because in many cases this is the #1 employer and the #1 form of income for those tribes, and the income that comes from those tribes is used to support elders, it's used to help pay for and supplement for law enforcement. So really, really difficult decisions there. But they've made those, and they've made them on behalf of the health and the interest of the health and safety of their enrolled members. And so again, we congratulate those tribal leaders for their courageous decisions, and we thank them for their collaboration. And then also Scott Davis and I have been in regular contact, and again had a chance to talk with Senator Hoeven yesterday, and also Governor Noem and Governor Bullock also are talking to their senators to continue to advocate to make sure that in the stimulus bills that are coming out of the Congress this week that we're taking full consideration of the needs of the tribes as well as the states. 2 other clarifications. One related to yesterday's, we had questions coming in related to the pharmacy executive order, which I signed yesterday to help us slow the spread of COVID-19. We talked about wanting to get testing up, and this executive order adds that pharmacists may conduct tests. Clarification there, it may conduct tests if needed by the Department of Health, and the premise would be that pharmacists would be able to step up and provide tests in case we ran out of capacity from our traditional medical health care advisors. We had some folks that were showing up at their pharmacist and say, I want to get tested. Again, the overriding direction that we're trying to give here is the same advice we gave yesterday, which is please call ahead to your standard medical provider first, and whether it's a clinic or a walk-in, please call ahead. You don't need to call 911 if you need a test. Call your medical provider, and unless it's an emergency, don't call 911 or don't walk into an emergency room, because we want to make sure that we're protecting our healthcare workers, give them a chance to be prepared to receive you. And we again continue to hear from the conversations from medical CEOs around the state that there's more and more testing options and places for people to be tested, either walk up or drive up to be able to do that. So again, call your provider first. Also, we had some questions yesterday regarding part of the planning that we're doing longer term. If we need additional capacity to get more medical workers, is that one thing that we did was ask that people that were retired, apparently whatever we say, there's a thing to take it to the extreme. We will not be asking elderly people who are at risk, who may have served the medical profession for 50 or 60 years to come back and be a nurse in the middle of this crisis. We do know from our workforce surveys that there are a lot of people that might have started their career as a nurse or some other role in a medical practice, and maybe they've gone on to a different profession, maybe their license is lapsed and it only needs a short amount of time to re-up it, or they could actually be working for one of our medical providers, but they're working in a administrative role as opposed to frontline nursing. So we were trying to talk about, again, that we do have people in our state on the bench that could step up, who've got the training if we need to do that. But of course, we'll proceed with common sense, as will all our employers. Next topic, one we have not talked about, but an important one. We got 3 branches of government in our country, 3 in North Dakota. We're very fortunate that we have a well-run judicial system in North Dakota, and they, like the other branches of government, are taking all the necessary steps to keep government running, but trying to do that in a way where you're practicing social distancing, and that creates a bunch of logistic challenges. But we're pleased to have today as a guest speaker the Chief Justice of the North Dakota Supreme Court. He's going to present on what the judicial system is doing to make adjustments related to this situation. And I just want to say it's an honor to have the Chief Justice here. I had the honor of appointing him when we had a vacancy on the Supreme Court several years ago, and on January 1, by a vote of all of his peers across all the judges and the judicial system, they named him to be Chief Justice. He's stepping up at a time, and many people not realize, but in addition to being the chief of the actual 5-person North Dakota Supreme Court, the Chief Justice actually is also effectively the executive officer, or the administrative officer, the leader of all the district courts in the state as it relates to personnel and systems. And so this is one of the reasons why he was appointed in the first place, is because of the great job that he had done in streamlining and automating processes at the district level. So he's got great background. And we were joking on the way down here today. Of course, he's stepping into the big shoes, 27 years by Chief Justice Vanderwall, as longest serving Chief Justice in America, and now we can view those as 27 pandemic-free years. And the Chief Justice, with all of his good decisions, also made the decision to retire just in the nick of time to hand off one of the most complex situations ever facing our judicial system ever, is how to run it when you can't have people all in the same room, which is what the court system is all about. But if there's one guy that can figure out how to get it done, it's going to be Chief Justice Jensen. So here he is, Chief Justice.
Governor, thank you for the opportunity to provide an update on the judicial branch. The judicial branch is mindful of our duty to continue to provide courts and access during the duration of this pandemic. We have a duty to provide a forum for protecting vulnerable persons. We have a duty to provide a forum to ensure the safety of children and those in abuse and neglect situations. We have a constitutional and a due process duty to continue to hold criminal proceedings. We're fully prepared to handle those emergency proceedings, and we're going to carry out those essential functions in a way that minimizes the risk of exposure to both our court team members as well as our court users. Our state is divided into 8 judicial districts. In those judicial districts, we have a presiding judge, a administrator, a clerk of court in each of the counties. We've empowered those people, in particular the presiding judges with their court administrators, to act, to respond quickly to issues that arise, and to reach solutions to those problems. It's important for our court system to be nimble during this pandemic. Our Constitution provides the North Dakota Supreme Court with authority to make its own procedural rules as well as its own administrative rules. We've used that flexibility to suspend jury trials. We've used that flexibility to stay deadlines for filing documents and holding hearings. We've waived the time requirements for holding speedy trials. And some of the specific examples are we've expanded the jurisdiction of our district court judges to allow them to handle statewide bail setting before initial appearances of criminal defendants. We've also expanded our criminal rules to allow individuals to plead guilty in writing and to be sentenced without an appearance in court. And we're handling, we have daily telephone conferences with the presiding judges and our administrators in each district. I'm very grateful for the advice and suggestions that I receive from them. They're leading our judicial response in every sense of the word. And they're leading that, our response with both innovation and insight. One example that I want to give is right here in Bismarck. Presiding Judge Bruce Romanek, very calmly and efficiently, you'll recall that the schools announced closure of the schools last Sunday. We began to take some proactive steps as early as Monday. Things progressed very quickly. Judge Romanek calmly and efficiently identified the cases in his district that needed immediate judicial resources and then postponed the remaining cases. You'll recall that we recently had an oil boom. One of the things that we're grateful for is our presiding judges in both the Southwest and the Northwest judicial districts. Judge William Haroff in Dickinson, as well as Robin Schmidt in Watford City, they've managed unprecedented sudden changes in case flow. And we're relying on them to give us some guidance in how we now manage these sudden shifts in case flow. We're also, as the governor has mentioned several times during these press conferences, that this is a whole of government response. To that end, the judicial system has been speaking with the North Dakota Association of Counties, the Department of Corrections, the Indigent Defense Commission, the State Bar Association, and together we've been identifying both obstacles and as well as opportunities to make changes. And I think the cooperation that is happening is typifying the spirit of our North Dakota cooperation. I do want to give a couple examples, and I think to let you know how we have to interact with other entities. The presiding judges, Gary Lee in Minot and Don Hager in Grand Forks, worked with the county commissioners to keep our courthouses open. Many people don't realize that the state judicial system operates inside the courthouses, but the courthouses are actually maintained and owned by the counties. If the counties determine that they're going to shut down all of their facilities, we don't have a location to run our court proceedings. Judge Lee in Minot, Judge Hager in Grand Forks really worked well with their county commissioners to maintain those courthouses remaining open. A similar example happened in Fargo. Presiding Judge Frank Rasek worked with local law enforcement to assist with regard to how we handle initial appearances, to make sure we do those in an efficient manner and that we're not filling up any of the correctional space unnecessarily. Again, we're committed to balancing our obligations and our duties as a court system with maintaining a safe environment to hold those proceedings. Internally, as of Friday afternoon, all of our staff that were identified as high-risk individuals, as well as nearly all of our administrative staff inside the Capitol, were removed to or were relocated to home workstations. Approximately 30% of our court staff, as of last Friday, was transitioned to remote home working. And then we will be transitioning the remaining staff, which should be accomplished either early or by midweek. We've done that without interruption in our electronic filing. Our clerk's offices have responded fantastically to this challenge. So again, I want to express my appreciation for the clerk's office because they've done it with minimal disruption. And that goes to the fact that North Dakota courts, a lot of people don't realize, are some of the most technologically advanced courts in our country. For more than 15 years, we've used interactive video and telephone conferencing. We have two of our judicial districts are very large. They extend from the North Dakota border all the way past the middle of our state. Presiding judges Daniel Narum in Jamestown, as well as Donovan Foudy in Devils Lake, are the presiding judges of those two really large geographic districts. And they're sharing their knowledge on how to do remote hearings, how to do telephone conferences. Justice Daniel Crothers has followed up with that. On Friday, our educational staff and Justice Crothers had an online tutorial teaching our judges how to conduct those online hearings and meetings. For the past 9 years, our judicial system has required all documents to be filed electronically. All of our records are electronic. That's enabled our people to move from the courthouses to their homes. It's now allowing us to continue our function of collecting fees, fines, payments, because we've done that for 9 years through the internet. Also, all of our mandatory reporting functions to departments such as the Department of Transportation, we're also doing that through electronic and automated workflow. We've been able to leverage that technology with regard to our juvenile court staff. And I want to take a moment. Juveniles are some of the most vulnerable people in our society. And unfortunately, we have individuals in situations of deprivation, situations in which they're being neglected or abused. Our Juvenile Policy Board, Justice Lisa McEvers, has done a fantastic job of finding ways to get our juvenile court officers and keep them in touch without having to be in person. It's an amazing task. I'm appreciative of it, and I think that that policy board deserves a lot of credit for continuing to service those individuals that are in need of service. One other very positive note, we have a family mediation program sponsored through the court system in North Dakota that handles our family law cases. We're very proud of the fact that it has historically settled 75% of our family law cases without needing to go to court. Sally Holloway, our court administrator, told me that our switch from in-person meetings to electronic meetings, we've maintained so far our 75% settlement rate of family law matters. Again, something fantastic that we're able to do without those in-person hearings. We do understand we have a duty to the public as well, and to disclose information. To that end, starting Monday, that's tomorrow, all Supreme Court hearings are going to be broadcast live. Justice Jared Tufte is coordinating our response to ensure that the public has access to our records and access to our courts. We have a strong judicial system in North Dakota. That's thanks in large part to Justice Gerald Vandewall, who was my predecessor in the role of Chief Justice. We have exceptional judges and presiding judges. We have an exceptional administrative team that's led by Sally Holloway, our state court administrator. But we welcome input from those that use our court system. I've been contacted by a lot of attorneys. It doesn't matter whether the input you want to give is positive or negative, it's going to help us improve. Our judicial system is prepared. We're doing its part. We're going to continue to fulfill our duty to provide essential services, and we're going to do that in a manner that limits our contact and carries out our essential functions.
Thank you, Chief Justice. I think you can see from that briefing why we're so excited to have Chief Justice Jensen and his fellow justices, the great presiding judges we have in the regions, and the great staff that he has really delivering innovation and doing that at a pace ahead of other states. It's fantastic, and thank you for being here with us today, and stick around in case there are questions, but really, really appreciate your leadership, and thank you for figuring out a way to keep the wheels of justice rolling even as we deal with this health emergency. Again, recap today, two additional cases in North Dakota, Burley and Pierce. We have hundreds, over 300 cases pending coming out of Cass County, majority of those we expect would be North Dakota cases. And so even though, again, we're pleased that we've got a low case count here, it's not the time to be complacent. We've got to be vigilant because we can see what can happen in other states. Michigan was one today that really jumped up in terms of number of cases. So we know it can happen in the Midwest, not just on the two coasts. And we also know that, again, these things I cited in both South Dakota and Montana as precursors to what might be happening here. We have received a lot of questions about childcare. I would want to give press and everybody listening a heads up that we are going to be providing additional guidance to childcare providers tomorrow at 4 o'clock. The team met with the team on Friday night, met with them again on Saturday. They're meeting today. We're getting input from child care providers, and again, we'll have guidance for child care providers on tomorrow at 4 o'clock. But right now, they're child care providers, which are private sector run, 1,800 of them across North Dakota, serving over 44,000 kids. They are not under the school closure rule. They're an essential infrastructure for the state of North Dakota. But each individual child care provider can make their own decisions. The majority of them have chosen to stay open. There are some closures, so check your own child care provider. But again, we'll have more guidance for child care providers tomorrow and thoughts about how we're going to make sure that we've got child care capacity for essential workers going forward if the crisis were to escalate. Lastly, again, NDUS, the North Dakota University System, which all of you have heard separately that they've made an announcement that all the campuses, all 11 campuses are going to be online for the rest of semester. If we do have people that are returning from spring break from travel areas that had, whether it's Colorado, California, Florida, if you're coming back from some area that would be considered a hot zone, we're asking that anybody who's traveled to those areas to either self-quarantine if you think you've been exposed, or register, go to report on the health.nd.gov. There's a travel site there, and you can indicate where you've traveled to, and you'll get instructions on what you should do. But again, people that are coming back from spring break, even though you're in your 20s with no symptoms, you can still be a carrier of this deadly disease. And so again, we want to especially reach out to all of those folks and make sure that they're practicing social distancing and self-isolating if they've been in an exposed area to protect those 20% of North Dakotans, over 100,000 people who would be considered vulnerable to this. With that, that concludes our formal remarks, and we'll go to some Q&A. Dave.
How many staff do you have at the state lab, and are they working well?
Question from Dave was how many staff at the state lab, and I think I'm looking at Mylin, but this would be actually people doing the lab testing, but we have 10 people at the state lab. I personally had an opportunity to go over there and do a tour earlier in the year before all this broke out, but we got a bunch of very dedicated people that are there, and I know they're putting in a lot of extra hours. And again, I want to thank them for how fast they're getting these tests turned around and the professionalism that they're exhibiting.
Is there any chance that more might have to be brought on a temporary basis?
Question is, are there more that might have to be brought on a temporary basis? One of the things that every state is looking at, if we've got constrained capacity for testing, is what to do with additional testing capacity. And there's really three sources. One, you've got your state lab. Then there are labs at all of our major health systems in the state. We know that, I know from talking to Sanford today, that their lab with their internal testing is coming online this morning. They're going to no longer be sending tests to Quest. They're going to be processing them internally, and they expect that they'll be able to do a 24-hour turnaround time, the same as we were at the lab with their internal testing. So we're going to see increased in-state capacity coming there. And then the third area would be our research universities that have labs that could be converted if we need to do that. And then the fourth area is private. We do have companies that are, in the biotech space. Aldebaran comes to mind, which has got substantial lab capacity, but we're not at that point yet. But it's possible that a private company that could actually convert some of their labs as well. On the Minnesota side, we know that they had a backlog the same way that was being held up going going to national testing labs. And my understanding from talking to Minnesota folks is that the Mayo Clinic, which is a big national organization and has got their own internal testing capability, is that they're going to help step up and help erase the backlog that was in Minnesota, which again may give us more results coming from tests that would be counties that were bordering the state of North Dakota.
Got a couple questions for the Chief Justice.
Okay. And we have to repeat them because they nobody wanted to hear.
So these are from my colleague April Baumgarten in Fargo. She wants to know, is there any chance or additional considerations for people who are currently in jail and may not have what we normally define as a speedy trial because of some of the conditions right now?
Yeah, the question was whether or not there will be any additional considerations for individuals who are being held currently in custody awaiting trial. I want to start out by just distinguishing two groups of individuals that are currently being held. Those that are awaiting trial, those are still subject to our judicial system jurisdiction. Once we've sentenced someone, we turn those individuals over to the Department of Corrections and the executive branch under a separation of powers. So once our judges have imposed a sentence, they become the executive branch issue. I think Ms. Baumgartner's question is specifically at what about the folks we're holding. We're continually looking at those bail and bond issues. To the extent that we can release individuals, again, those are going to be individuals that we can assure are not public safety threat, as well as individuals we can assure that are going to come back and be subject to our jurisdiction when this is over. So, that's a continuing process. A lot of that comes from pressure from local correctional facilities trying to maintain numbers that are manageable with regard to controlling any viral infection within their facilities.
If I can ask another one here. She wanted to know what ways people can get court documents these days. It's a little bit harder given some of the closures of the facilities, I believe.
Yeah, the question is essentially public access to court documents. Our public access to court documents has primarily been facilitated through terminals located inside of county court buildings. Now that that a majority of the counties have closed public access to those facilities, the public terminals are not available. We're looking for solutions to that. Justice Tufte is going to be spearheading our public access. We're doing what we can to allow public access. That's going to take us a little bit of time. How we do that in a way that doesn't expose individuals within our judicial team, as well as people who use the courthouse from any undue risk. But currently, the public access terminals are generally not available.
Can I add just one more? You sort of spoke a little bit on this, why it's better to leave some of these decisions up to individual judges, whether or not to impose a court or whatnot. Can you explain why that wouldn't be better to come from the Supreme Court?
Well, we're meeting daily with the presiding judges, and to the extent, for example, terminating jury trials, that's something that's easy to do on a statewide basis. A lot of times it's hard to identify a particular type of case that might have an emergency. For example, a family law case may be a divorce proceeding not involving children, no allegations of abuse. I can't identify those necessarily by simply looking at a broad class of cases. We have fantastic trial court judges in North Dakota. They get exceptional training. They, in large part, perform their jobs out of a sense of public duty and service. They will do a fantastic job of making decisions about what cases need to proceed forward. I'm very comfortable with that.
Jacob?
April 1st, the USDA was set to unveil new food stamp program rules that would not so much restrict the states from signing up, but it would restrict the states from being able to create their own qualifications for food stamp programs. Wondering what the latest is on possibilities of expanding qualifications in the state during the time, and/or the latest on reapplying for programs like SNAP.
Question was a beautifully detailed question about many aspects of the USDA food stamp program or the SNAP program, and some April 1st dates and some announcements the feds had made and what the state might be doing. We're going to continue to advocate with the federal government on things that we think work well for North Dakotans. The federal government right now has got, again, we probably overuse the word unprecedented, but this administration listens to the state and then they make changes. I mean, this isn't like, hey, we got an idea and then maybe 10 years from now the rule's going to change. I mean, things are changing, as all of you know, changing very fluidly. There's going to be a strong enhanced need nationwide for nutrition programs, whether it's WIC or SNAP or whatever it might be. And I know that the USDA is looking at all these and trying to figure it out. We highlighted some of those in an answer yesterday during Q&A, where we know there's going to be some challenges. We've talked to the tribal leaders about some of those. But one thing I can clarify is that you can today. It's up on the website, and I think SNAP is. It's SNAP. WIC is through the health department, I believe. Is that correct, Mylin, on the website? And then for SNAP, it's USDA, but I want to make sure someone can toss me where we go to in terms of where people apply. But you can apply. I was told yesterday after our conference, you can apply online right now for SNAP. There's no deadline date. There's no waiting. You can go and start applying right now for SNAP. And then we'll continue to work on, understand that the feds are saying states can't make up their own rules, but we're going to continue to provide feedback to make sure that the rules that are there are common sense so that people can actually can get the food they need during these challenging times.
There will be new guidance going out to WIC agency staff first thing tomorrow.
Okay, and then that's coming from the feds, Mike. Is that new? There's new guidance coming out that'll be up on our website tomorrow.
For WIC agency staff.
For WIC agency staff. So those will look for that on the health department website. But again, these are fluid and changing. Yes.
Governor, I have two questions. The first might be for Ms. Tufte. We got a message into the station today that a young man in his 20s went to his doctor. He had symptoms. His doctor most likely told him that he had coronavirus, but they can't test anyone unless they're admitted to the ER, even if they're older than 65. And I know on Friday, Ms. Tufte had said that there's no longer a shortage of tests, and they want to know, if somebody goes to CHI or Sanford, do you have to be admitted to the ER first now? Have things changed?
Question was, there was a incident reported that some person an individual in their 20s who had symptoms had been told by a provider that they were not able to get a test unless they went to the ER. That is not the guidance that we're giving. The guidance that we gave yesterday when we had our medical health officials up here is the guidance we're still giving today. We can offer that same guidance again, but I would ask this individual to call the health department. We can get more specifics and find out. But again, we want to test people that have had that are either, if they're in a vulnerable population, they've got symptoms, or they're at risk, meaning at risk of having been in contact with someone who's a known positive or a known travel location, or if they are at risk because they're working in the medical profession and they may have been in contact, because we're trying to protect our workforce protection. But it sounds like that this person could have or should have been eligible for a test. We've got the testing capacity, and they should have been able to get that test without going to emergency room. Again, we want people to call ahead of time. We actually don't want people to go to emergency rooms because that could end up infecting everybody in the emergency room if they are positive. But thanks for bringing that up. But again, we would encourage, if anybody is seeing this kind of stuff online, or you're hearing that people are having trouble getting tested, we've got the hotline going at the health department. They can call there, and we'll work to make sure that we can help them get in contact with a provider and get the right information.
And then my second question is, officials, including yourself all across the country, have been preaching social and physical distancing and washing your hands and no close contact. But even coming here today, I drove past the boat ramp on River Road, and it was full of people, like it was a normal spring day. When you hear things like that, how frustrating is it?
Question was, public officials are asking for social distancing, but the drive here today, drove by the boat ramp here along the Missouri River, looked like a normal Sunday. A lot of people, not appearing to practice social distancing. The question was, how frustrating is it? I think, again, we just want to keep trying to get the message out to everybody. And this is a message that it's by practicing individual responsibility, practicing that social distancing is going to protect you. It's going to protect your family. It's going to protect people that you've never met before. And so we just, again, keep appealing to people's concern, not only for their self concern, but for the community. We got to be thinking about more than ourselves right now as we practice this. At the same time, we know that there's a real thing. Cabin fever is a real thing. You got a beautiful sunny day like today, that people want to get outside and get some fresh air. So we, are encouraging people to go for a walk, walk your dog, go for a park. But we're not encouraging people to have close contact when they do that. I did say earlier that the fishing season was going to be open in North Dakota, and so maybe I gave the wrong guidance there. But we are going to have fishing. But if you're getting in a boat, make sure you're getting in a boat with that somebody that that is not either a vulnerable person or someone who's been at risk or contact with someone else. Otherwise, you're risking that person and yourself. I guess I'm not saying fish alone, but fish with some distance between yourselves. But fresh air is a good thing. Getting outdoors is a good thing, and North Dakota is a great place to do it. And I would just. I can't resist putting in a plug because we have a fantastic fisheries department at the North Dakota Game and Fish, and we've gone from less than 100 lakes 20 years ago to over 400 that are stocked. And last year was the first year that fishing outpassed hunting in our state in terms of revenue and licenses. So I get why people are itching to get out there, because it's a great way to spend time in North Dakota. Jeremy?
300 pending tests that have gone out to the private lab that are waiting back for Cass County. Can you just go quickly why that decision was made by the provider, when we would be expecting those back? I know you said there's a 7-day turnaround, but I'm wondering if there's a date that they all went out. And then where exactly is that lab located?
Number of questions about the 300 pending test cases, and I'll try to frame answers in ways that will indicate the question. First one is, I don't know where the Quest lab is. They're a national organization. They may have multiple locations where they sent stuff to, but I don't specifically know. Number two is, the question was, why did they go there? They went there because they were promised a 3-day turnaround time, which seemed reasonable. Now they've pushed that back to 7. I think they started doing this, what's today, Sunday? Last Monday is approximately when they sent the first one, so the very first ones would come now. So I would expect that those 300 will come in through this week. Now that Sanford has the ability to do 24-hour testing, the president of Sanford Fargo indicated that they were going to be reaching back and contacting the 300 people who'd taken tests. Many of them had been sick and were now recovering. So some may be, may now no longer have symptoms, but they were doing their job as a healthcare provider to check in on all those folks. And they do have the ability, and they're considering this on whether they would ask some of those people to come in and get retested on a 24-hour test that they could run at Sanford if they think there's going to be further delays, or if they, say they tested them, on Friday, and now they don't want to wait 7 or 8 days for it to come back. They might get news faster if they just came and retested them. So they're working through their options, but this is this is a reflection on the national crush that went to the labs, not a reflection at all of their decision to try to follow our guidance, which was, let's get more people tested. So we appreciate that they and others were doing that. From the polling around the state so far that we've been able to do today, we don't think that there are other pending cases hung up at national labs. We think that's the one place, but it is a significant number.
Are they still sending tests to that lab, or are they?
Question, are they still sending tests? And my understanding today is no. And my also understanding that was Fargo only. Bismarck, Sanford, for example, was sending all their tests to the state lab. Any questions from online coming in? Okay, Well, seeing no other questions, again, we want to thank the Chief Justice for being here. Thanks, Lieutenant Governor Sanford, again, for all the great work you're doing. Thanks to our co-leaders, Mylyn Tufte, our State Health Officer, and Major General Alan Dorman, leading the Unified Command. And thanks to the media here for the great job they're doing to help get accurate information out to all citizens in North Dakota. And again, North Dakota smart, ND smart, stay smart, keep doing the social distancing, let's keep the spread down. Like I said, we're happy that we only had 2 more positive cases today, but we also know that we know that underreports the real situation we're in, and we understand from what's happening in neighboring states that the risk remains high, that we could have outbreaks here, but we're going to help, again, save lives by being smart. So thank you all, and we'll see you tomorrow at 4 p.m.